Today I am talking about the role of carotid endarterectomy in stroke prevention. There are three types of prevention: primary prevention, secondary prevention and tertiary. Primary prevention is behavioral modification to alleviate risk factors in the form of exercise, diet modification, avoidance of smoking, alcohol and reduction of high cholesterol blood levels. Secondary prevention is the use of drugs to overcome the risk factors which cause stroke, such as hyperlipidemia. Tertiary prevention is the use of either surgery or stents to prevent a major stroke from happening in a person. Now, carotid stenosis can be of two types. One is called as asymptomatic stenosis, where the carotid stenosis is picked up during routine investigations done for some cause. Now, if the stenosis is more than 70 to 80%, then the person has a high risk of developing either a minor or major stroke in the future. Hence, carotid endarterectomy surgery can be done to remove the atherosclerotic plaque in the carotid artery, which is the source of embolus which causes stroke. Now, when this stenosis is more than 70 to 80%, based on the counseling we give to the patient, if they agree, we go ahead and do carotid endarterectomy surgery. There are symptoms. The second variety is symptomatic carotid stenosis, wherein patients with more than 60% carotid stenosis or obstruction present with either reversible ischemia known as TIA or have minor strokes from which they recover completely. Now, such kind of patients have a very high risk of having a major stroke within the next 1 to 3 months. Hence, they must be subjected to some preventive measure which permanently removes the risk of stroke from the carotid stenosis. Hence, these patients undergo carotid endarterectomy surgery. Now, when we do carotid endarterectomy surgery, we use continuous EEG monitoring to monitor the health of the brain under anesthesia, and we use cerebral protection agents because we block the blood flow to the brain from the carotid artery while removing the plaque. Hence, we give protective agents or drugs which help in preserving the brain tissue. And because of these measures, there is rarely need for shunt placement during the surgery. Overall, carotid endarterectomy has several benefits when compared to stenting, because these patients don't have to be on very long-term antiplatelet therapy. Antiplatelet therapy can result in gastrointestinal bleeding or sometimes occasionally in intracranial bleeding known as subdural hematoma. So, those patients desirous of wanting to avoid these long-term complications with antiplatelet agents prefer to undergo carotid endarterectomy surgery. Of course, the patient has to be fit to undergo carotid endarterectomy surgery. Of course, patients undergoing carotid endarterectomy surgery have to be fit to undergo the surgical procedure, and those with very severe heart disease are not fit candidates to undergo carotid endarterectomy surgery, and they usually undergo stents. Overall, carotid endarterectomy surgery is a very safe surgery and effective way of tertiary prevention of stroke. And in centers who do this kind of surgery regularly, the results are very gratifying. Thank you.